Welcome back. In a report released last month, the Department of Health and Human Services says gender-affirming care poses a risk to children's health and well-being. HHS Secretary Kennedy now introducing what the department calls actions to protect children from harmful medical interventions.
So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice. We're done with junk science driven by ideological pursuits, not the well-being of children.
Despite medical groups pointing to evidence that gender-affirming care saves youth lives, the health department finalized a report claiming it found medical dangers posed to children. It alleges that gender-affirming care, including puberty blockers, cross-sex hormones, and gender-affirming surgeries, cause significant and long-term damage. The House has now passed a bill that would criminalize gender transition treatments such as surgery and hormones for minors. The Human Rights Campaign is slamming the report, saying it's a, quote, sham, and calling it a political document. Clinical professor and pediatrics at Stanford University, Dr. Marissa Ladinsky, joins me now for more. Doctor, thank you for your time. And I want to ask you, because the HHS says that it found medical dangers related to gender-affirming care, including sexual dysfunction, psychiatric disorders, surgical complications, and regret. I'm curious, do you think any of these are accurate?
Alex, first, thank you for having me. And while this is what the HHS is purporting, this area of medicine is immensely well studied. It's been in place for decades and has not raised or even come close to the guardrails of our profession of ethics committees or malpractice law. The most recent, and we look at science is our superpower, and it is how we underscore evidence-based medically necessary care. Exhaustive literature searches were done in Utah over the last 2 years, commissioned by non-political scientists, and that body of literature absolutely comes to the opposite conclusions, that the medicine is safe, the treatments are effective in terms of mental health, and there is an immense wealth of true science around this line of healthcare.
Well, and to that point, both the American Academy of Pediatrics and the Endocrine Society rejected an invitation to contribute to this report. So, I mean, what do you think that says about it?
It says that those folks may have questioned the methodology under which the report was being generated, because there is scores of evidence-based science, peer-reviewed, and settled science in this area.
Well, and the same report explains how pediatric medical transition, a medical step within gender-affirming care, does not always involve hormones or surgeries. What does it say about the Trump administration's argument that this kind of care is dangerous?
You are completely correct in that the care that we're talking about is a long-held tenet of primary care pediatrics, the affirmation of a child as they grow and develop. It does not always mean medicine, and it certainly does not mean surgery. But these decisions, if those medications do come into play, happen over many, 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 many years with the input, not just the input, but the informed consent of all parents or guardians.
Yeah.
This is high quality healthcare.
According to the Trevor Project, which has condemned efforts to restrict health care for transgender youth, gender-affirming care has been shown to reduce depression and suicide risks. This is backed by the American Medical Association. And if this type of care is no longer an option, how do doctors pivot their treatment recommendations?
Right now, such an action would place many, many youth at an incredibly higher risk than they already face of harm. How would doctors pivot? The hope is that mainstream evidence-based medically necessary care is not used to threaten doctors with criminalization. Doctors will come together and always continue to stand up for children.
Dr. Linsey, thank you so much for your time.
Thank you for having me.
Of course, of course.